Welcome viewers to another edition of Health Matters. We have with us today Dr. Ataide, Dean of the Goa Dental College. In fact, she is its first lady dean and a respected figure in the field of oral healthcare in Goa. She has been in the teaching field for about 30 years now, and so obviously the focus of our discussion today will be oral and dental care and dentistry as a practice. Dr. Ida, welcome.
Thank you.
What are some of the main causes for a patient's visit to the dentist?
Initially, many years back, the patient used to go to the dentist only because they would get some pain. But nowadays, dentistry, because of the awareness in dentistry, the patients just walk into a dentist for any silly reason. It could be straightening of the teeth, it could be a decay in the teeth, it could be bad breath, any such thing. So the dentist is nowadays is equipped to take care of any such complaints that the patient might be having.
Okay. So what might be some of the key reasons for the occurrence of such problems?
See, there is no certain reason for decay of teeth. There is no certain reason for bad breath. But we can zero down to having these refined foods that are taken very freely nowadays, especially by youngsters. Then the soft drinks that erode the teeth and cause decay of the teeth. Then irresponsible brushing. Some people have irregular brushing and some people have irresponsible brushing. Some people brush too much and some people don't brush at all as many times as they should.
Okay.
So all these are causes that...
So when you say as many times as they should, what's the bare minimum or the recommended?
At least morning and night.
Okay.
But ideally it should be after every meal, especially if you are having some carbohydrate or some sugary substance.
Okay. So when you say now after every meal, and given that most people either have a working day that's either in the office or in school, how do they circumvent that? Is there a way?
No, they can either rinse, just a thorough rinse, that should suffice.
Okay.
But yeah, at the end of the day, just before going to bed, and that's the time where the microorganisms are more active because your mouth is closed. So that time you have to brush before going to bed.
Okay. What are some of the different dental treatments offered by a dentist?
We have initially the tooth used to be considered as just a unit in the mouth,
Right.
but now it is considered as in the whole complex. We have specialists for all the problems, in the sense children's dentistry is a separate subject.
Okay.
Then gum disease is treated as a separate subject. Restorations of teeth and root canal treatment, extractions, prostheses, all that is separate.
Okay.
In the college, we tend to treat the patient on a interdisciplinary way, in the sense that if a patient comes with one complaint, we see all the other complaints alongside and refer the patients to the specialist. In a private clinic, it may not be so, but nowadays the trend is that the dentists call the specialist to their clinic and to see this certain treatments that they are not able to take care of.
Okay. Now you talked about, when you talked about segregation, you mentioned children, and this is something I'd like to ask. We know parents take children to pediatricians, but we don't hear of parents taking children as regularly with a specified schedule to a dentist. I think that's not part of the way typically we tend to live in India, at least. Do you have thoughts on that? Is that something that should change? Is there a recommended frequency?
Nowadays, the trend that you're talking about is changing.
Okay.
Because there are lots of camps which are being held at school level, and the children are being told that they need to come to the dental college or they need a certain way to brush, they need to adopt a certain way to brush, or even the parents are requested to bring them to the college,
Okay.
or to a pediodontist.
Okay.
So The awareness is much more, and like the treatment is also given at a higher level now. So each child is, the dentition of each child is treated on a very important level, because
Okay.
their primary dentition is the anchorage for the adult dentition.
Okay. Why is dental treatment so expensive? It's one of the things that we think about. We say, oh, visit to a dentist, it's going to cost me this much each time.
Yeah, maybe that is the reason that we are having so many patients in dental college.
Okay.
But the treatment is expensive because with a lot of research, newer equipments, more precise equipments are being marketed, and materials are very costly. So for
Okay.
any small little thing, it is a lot of money which is involved, and finally the patient has to pay for it.
Mm.
Another thing is that with the amount of diseases that get spread through saliva and blood, we have to take
Right.
extra precautions, okay, in having a lot of disposables like masks and caps, bibs and aprons. So many of our things are disposable, so that costs money. So naturally, for every patient we discard.
Okay.
So
Are there other things that a patient should insist on in terms of a change or a new set of equipment being used when he or she sits in a dentist's chair?
maybe not, because all the dentist himself or herself cannot take a chance, of contaminating the other patient.
Right.
So sterilization is upmost.
Okay.
So all the instruments that are used in the previous patient, whatever cannot be discarded, are properly autoclaved.
Okay.
Okay. So this nowadays nobody requests as such because it's taken care of.
Okay. Okay. Another thing that one sees a lot of is the chewing of pan and tobacco. And what are the effects of habits like this on oral health care?
Yeah, there is. I don't know if everybody knows, but there is smoking tobacco and smokeless tobacco.
Okay.
Okay. In smoking tobacco, we have the cigarettes and the bidis.
Right.
Even the dumti. In Goa, it is very common, where the tobacco leaf is rolled and
Okay.
smoked and
Okay.
lit and smoked. And the smokeless tobacco are like the pan, and the gutkas that
Right.
we put in the mouth. So whatever, but people feel that this smokeless tobacco is not so dangerous, but whether it is smoking tobacco or smokeless tobacco, it contains a dangerous substance which is called nicotine.
Right.
Nicotine is toxic,
Yes.
and it impairs the immune system of the body.
Okay.
Besides that, for us for oral care, it impairs the regenerative system of the oral tissues.
Okay.
The potential of regeneration is much impaired
Okay.
in tobacco users.
Okay.
So we consider it as a precancerous substance.
Okay.
So some signs that call for medical attention are like when the tongue is heavy, the mouth opening becomes smaller, then there is generalized pain in the mouth, or the teeth are very weak and start moving, or there is a swelling inside the mucosa or on the neck. So these are the initial signs that the patients complain of, and it has to be taken care of.
Okay. I'd like to spend a minute on a subject of great curiosity, which is white teeth. Advertising focuses on it, product development focuses on it, and it is a matter of great aspiration in many ways. I don't know in India whether we have as many over-the-counter products as we do abroad, but you certainly hear the claims in toothbrush and toothpaste advertising. My dentist, however, has always advised against it, given that it's supposed to weaken or wear down the enamel. But could you speak to this subject and tell us whether there is any truth or it's something that one should even worry about?
See, it all depends from case to case. If your teeth really don't match your skin color, okay, and you want an improvement on that, you can certainly go for bleaching. But if your teeth are not a very good color and they are crooked, then we can offer the patient veneers, you know, and there are really some thin veneers called lumineers that we can give, and it improves not only the color but even the alignment of the teeth. Okay. And so the patient, okay, whatever your dentist says about hatching the enamel and all, that is quite true. Okay. But then there is a procedure which counterbalances that also.
Okay, so these veneers then is the effect, is it a permanent effect in terms of the change in shade or
yes,
coloring?
Yes, that is more permanent than your bleaching.
Okay, but over a period of time with the incorrect brushing, could that darken as well? Or?
No, they will not darken, but they can crack because they are very, very thin. So if you bite into something really hard, or you're not a little careful about what you do with your teeth, then they can crack, and then a small crack is very much visible because it is the front teeth. So then you will have to remove, if you have done veneers for 2 or 3 or 4 or 5 teeth, all those will have to be removed because of one.
Oh, okay. Okay. I'd like to ask a question on a different track, which is now being an academician yourself and as Dean of the Dental College, what are some of the challenges that you see?
In Goa, there are already quite a few dentists. In fact, in the coastal belt, there are too many dentists, and the competition is a bit sometimes it's not too healthy, but nevertheless. So the challenges that we face is that we should bring up our institution to the level that our students can go abroad and be chosen, be selected.
Okay.
So level of education should be, we have got a very good team as academicians. Okay. The teaching staff of the dental college is very good. Only thing, our infrastructure is not so good, so we have requested the government to help us out, which they are willing to do, but of course it takes time. We really lack a lot of things. We lack good chairs, we lack space, and we lack a lot of things. So that is on the way. It will take some time.
How many years does it take for a student to complete dental studies?
They have 4 years of graduation, plus 1 year internship.
Okay.
And then they have 3 years for post-graduation.
Okay.
But post-graduation is again, they have to appear for a NEET exam, and then if they get through, then they are selected.
Okay. And so when we hear about implantologists, maxillofacial surgeons, orthodontists, are all of these part of the master's program?
Yes.
Okay.
Not implantologists,
okay,
but maxillofacials and orthodontists, prosthodontists, all those people, endodontists.
Dr. Aida, is there a message that you have for our viewers in terms of oral health care, in terms of the definite do's for each of us in our daily routines?
Yeah, I would like to tell the public that besides brushing morning and night, they should have their regular checkups done with a dentist, because there is a lot that cannot be seen by the person but can be seen by the dentist. So unless they get inside, sit on the chair and open their mouth, it will not be taken care of. There is a small video which I would like the viewers to see. It shows many of the treatments which are being done by a dentist, and it enlightens, because many people are frightened of the different treatments. So this video will show you that everything is not so frightening, and when you go to a dentist, you'll be in a better position to understand what a dentist has got for you.